Here is a case in which we see a chest x-ray. Perhaps we can't see it close enough to understand all the fine details which a radiologist might have the advantage of looking at. But what we probably can pick up is the fact that the lungs are generally a little bit denser than normal. They're not quite as open and aerated as you would expect to see. Perhaps it would appear that these lungs could very easily be very acutely congested. In addition, if we had the advantage of actually looking at these lungs, we could see that lungs generally should be like sponges. When you squeeze them, when you feel them, you should feel little bubbles. We don't see too much by way of bubbles here. What we do see is generally watery fluid seeping, oozing onto the cut surface of the scissors or knife or whatever this is. Microscopically, if we were to look at this part of the lung represented by generally increased densities on chest x-ray, we will see that the alveoli are generally filled with fluid. The fluid pretty much looks like water, perhaps proteinaceous water would be a better term. And that's why the lungs are not as aerated as they should be, either radiologically or grossly. And that's because the alveoli are filled with fluid. Not only are the alveoli filled with fluid, but the alveolar septae are also tremendously congested. Do you remember the last case we saw of passive congestion of the lung? We saw tremendous numbers of increased capillaries within the septae showing congested red cells. Well, if that was severe enough, the fluid would leak out into these alveoli. And this fluid is acute pulmonary edema. Even though acute pulmonary edema can occur through a variety of methods, a very, very acute sudden heart failure would be the most common reason. And especially if it was left-sided acute failure, in which you have very significant backup of fluid into the lungs and to the alveolar capillaries, and then oozing out of the fluid within the alveolar spaces. Acute pulmonary edema is very, very often seen with very acute deaths. Thank you very much.